right here. Right, kneecap, knee, side of my knee, and a pretty stabbing pain if I put my 3 fingers right here as it comes through the side. It hurts right there, right here, right as you get started running, about maybe even a 300 yards in, and it's a hot poker knife into the side of the knee. We're talking about the runner's knee, IT band syndrome. Hey, what's up everybody? So we've talked a little bit about this before, but it needs to be revisited just a little bit again because it's such an injury that runners can rehab through without a lot of the physical therapy intervention. I just help people get the quick remedy, and then they're still required to do the work, the hard work by themselves, right? So we're talking about IT band syndrome. Now, where I differ from the internet and word searches and stuff like that, if you looked up runner's knee, it shows being maybe like a patella issue in the knee, but it's more common what they describe the runner's knee symptoms to a jumper's knee. Let's just put that aside. The runner's knee, or a IT band syndrome, is what it's commonly referred to as a hip demonstrating the inability to control the knee, okay? When we have knee pain, we've got a knee sandwiched between a hip and an ankle. And so we can rule out right away knee pain by fully flexing the knee, fully extending the knee, and putting a little bit of torque and twist in the knee while we're doing it. The knee is rather simple in the matter that it just needs to bend and it needs to straighten, okay? Now, there's other complexities to it, but that's essentially what's happening. For a runner at the hip, there's a lot more dynamic stability that's taking place in there. And there's a few of the muscles that are in the hip, glute minimus, glute medius, and glute maximus, including the TFL, okay, it's a muscle on the front of the hip, help stabilize the hip and have an intimate interaction with the IT band, discomfort in there. So it's not painful to necessarily walk around the house. However, up and down stairs will create a problem and you'll feel it, as well as when you kind of start that run, maybe like 30, I don't know, less than 30 minutes, right? You're like 300 yards in and bam, hot knife into the side of the knee and it hurts bad. It stops you. You have to stop running and you will continue to walk your way home, or you'll try to run a little and it'll hurt and then you'll pull back and you'll repeat that vicious cycle. So if a runner ever complains about having knee pain, the first thing I like to do is assess the knee, of course, and try to determine whether or not the pain is radiating from their knee. So first thing I'll have the patients do is we'll just flatten the knee right out, right? Push straight down. Let's see if you can get the knee all the way down straight with no pain. Maybe just a little bit of stretching in the back, it's not a big deal. Move the patella around, or the kneecap around just a little bit. And the next thing I do is fully flex the knee and try to get the heel to touch the butt, okay? In somebody that is complaining of knee pain that can touch the heel to their butt like this, they don't have knee pain. We've pretty much ruled out. All this structure has to essentially do is bend and straighten. That's the initial assessment. If you can at home pull your knee toward your chest and get that heel all the way down, it's more than likely not something coming from your knee. Other times you could have a quad tightness, infrapatellar tendonitis, or some other structure, maybe deep inside the knee, a synovitis, or maybe like what's called a fat pad irritation underneath the infrapatellar tendon. So those are all things that I'm trying to rule out, but can screen really, really quick by fully flexing with no pain and fully extending with no pain. That's the assessment. All right, so we're going to talk just a little bit about treatment now. For the IT band syndrome, right? It's the knee pain, but the problem's coming from up onto the hip area here, okay? And this is where a lot of the times our exercise comes into play, and I'm going to show you those exercises, but just kind of real quick in an effort to kind of show you maybe what you could be doing at home to do a little bit of a treatment. So right here on the top of the hip is the bone, and then up here is the top is the ilium, your iliac crest, okay? So between those two parts right there, inside this whole area here, front part, lateral part, and then a little bit of the posterior part. Just don't dig into the glute max. You got the piriformis nerve that runs down the back of the leg right there. You want to stay high or stay towards the sacrum over here, okay? Working the meaty, fleshy part right there and working to get that muscle to work out there, okay? So this is where the focus of treatment is. Okay, so here's the first exercise, right? Patient's in side lying, and then the top leg is gonna come back. And we're gonna go down and up, down and up, okay? So down and up, basically what's trying to happen is the heel is trying to clean the wall behind you, okay? So it's gonna stay directly behind you. And in other videos you've seen me put like a foam roller in front of you, or something of that nature to help keep your foot or your leg behind you, okay? If your leg drifts forward, you start to work the quad muscle, and that's a nice strong muscle. It's working enough and doing its job. So that's not what we need to work on. We need to work on the muscles on the back side, back of this hip bone, the fleshy meaty part, and then we got it good. That's called side lying hip abduction. All right, so we are on to the exercise portion of the treatment for the runner's knee or the iliotibial band syndrome. So what I'm demonstrating here is we're putting one of those exercise bands or an exercise loop. You can put it in 3 different positions. So the first position is going to be over my knees, and then I'm doing lateral stepping right and left, keeping the knees straight, okay? So there's an alternative method to doing this, but for this demonstration, I'm having my knees straight and the band is above my knees. I'm now modifying or moving into the band around my ankles. This will increase the complexity of the exercise, moving lateral with the legs straight, and you'll start feeling the intensity at the hip region, kind of at the lateral side of the hip, maybe even a little bit into the glutes. All right, and then progressing on with the complexity of the exercise, we put the band down around our toes. So now we're trying to prevent the band from bringing our toes in. We're rotating the band out and moving lateral with our legs stiff. Okay, so now we are doing the modification. So now it's lateral stepping with the band around our toes, but our knees are in that bent position and we're moving lateral. So you can make that adjustment any way you want, band above knees, at ankles, or around toes. All right, everybody, that's going to conclude the runner's knee, right? What I interpret as runner's knee injury or the IT band syndrome assessment and treatment. I think that's real important for runners to understand. Make sure you're ruling out a body part that you think it is, and it's not very or it's very counterintuitive as to what this injury is. The problem is up at the hip, and sometimes it's at the foot and ankle, but for the most part it's a hip problem manifesting in the knee, and that's what we need to understand there. So as you pull your miles back a little bit, and that's okay, you can still run, you just need to run up into the point that you have pain at the side of your knee. So with IT band syndrome, you are able to run. We just want you to bring your miles back to where you're running up until the point that your knee hurts and stopping. So if you've figured that part out, if it's a half mile or 3/4 of a mile, go ahead and run. You can do that every day if you'd like to, okay? The exercise components are the most important. The manual treatments are beneficial. Stretching is probably the least beneficial of this kind of treatment. And so, call that whatever controversy you want, but the stretch component of runner's knee or IT band syndrome, it's not indicated, and it's not beneficial. To a small extent, you can do a couple of exercises like a piriformis stretch or something of that nature, but not necessary, okay? So enjoy the video. Hope everything answered some of the questions you may have and brought some light to the treatment of this. So happy running out there, everybody, and if you have any questions, reach out to me.